Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education.
Hey guys, welcome to Chapter 5 in our Masterclass Series. Today's topic is on polynucleotides, in particular, the product that's been, taking Australia by storm a little bit, Rejuran, and we're joined by Dr. Stephen Liew, well-renowned plastic surgeon from here in Sydney, Australia. Before we jump into today's podcast, Jake, is there any news you'd like to inform our listeners about?
Well, first of all, thank you for all your supportive messages and texts and so on for our episode 300. We appreciate the support. That was awesome. We had a really good feedback. We are still running our competition, our IA competition. There's 6 days left. So make sure you get your entries in. You can get the link down below to apply. And actually all the instructions are on our reel on Instagram from May the 16th if you want to get all the information on how to apply. It's a good one. We're taking someone, lucky person, all the way to Canada, to Toronto in September. Obviously, your flights will be paid, hotel will be paid, and we're going to a great conference that I've not been to before called the Canadian Aesthetic Expo. David and I will be there sort of doing our own talks. I'm part of the Cadaver Lab. You're doing a business workshop.
Yep.
And then there's 2 days of an educational sort of conference style live injecting and lectures as well.
And we're doing something pretty different there, but we're not going to reveal it just yet.
Yes. And also the winner will get to a live mini podcast with us.
Awesome.
So that'll be fun. And also you get a ticket to the cocktail soiree as well.
Ooh.
Yeah. So there we go.
Fancy.
Any other news? I don't think so.
No.
That's it.
Let's jump in.
Yes. All right. So, Stephen, you have been on the podcast before. In fact, you've been on episode 61, 126, 192, and 246.
That might be a record.
You're in danger of becoming our most sort of welcome back guest. But thanks for coming back.
Thank you very much.
No, it's our pleasure. Now, tell our listeners who maybe haven't come across you yet, they haven't listened to those episodes, about your background and also how you became the partner with the company called Rejuran, who we're going to be speaking about today.
Hi. Well, guys, thank you for having me. My name is Dr. Stephen Liew. I'm a plastic surgeon based in Sydney, Australia. Been a plastic surgeon for the last 20 years. My area of interest is facial aesthetic surgery, as well as any non-surgical aesthetic innovation, from injectable to devices to anything non-surgical. Rejuran, I've came across the name Rejuran probably about 7-8 years ago when I was touring Asia. And then I had the opportunity to play around with it. And then when they talk about the origin, then I got a bit excited. I think we all agree that things like regenerative medicine is probably the new kids in town, particularly in the last 5 years. There's not a lot of science in it, but we do see those of you, including you, Jake, who've been using it, you do see patients come back for more. So clearly there is something in there. And what I always say, there is no evidence base doesn't necessarily mean absence of evidence. This is something we need to be aware of, but we need to be a little bit cautious. So I've been playing with it. It's been available in Australia, I think sometime in June, July 23. It was launched in Aesthetic 23, by the way. I thought I'll throw it in. And then it became commercialized since then. I started playing with it just a few months beforehand, like most of you guys. And I said the rest has been history. So we've been playing with for about, 2.5 years now with a real-life clinical experience. Clearly, it's originated in Seoul, South Korea. They have been using it for the last 10 years. So this is nothing that new. So I think most people who use it and notice that the patient come back for more. So clearly there is some efficacy in there. We can talk a little bit about efficacy, et cetera, et cetera. So that is just my background associated with Rejuran.
When you say there's no evidence, but that doesn't mean that there is an absence of evidence. Can you explain that as a layperson? I'm trying to understand what you mean by that. So they found that this substance does something, but they don't have the clinical trials behind it. Is that what you mean?
Yeah, let's bring it back. I think a major confusion in the market globally has been the so-called PN, which is polynucleotide, versus PDRN, which is polydeoxy ribonucleoside thing. So let's get the nomenclature. PN for Rejuran arise from the male reproductive organ of Pacific salmon. PDRN from Rejuran brand arise from the sperm, right? So that's the major difference. I think based on the molecule-wise, I think there is new articles classifying PN essentially has a longer molecule. I think it's about 1,500 kilodalton. Anything below that tends to belong to PDRN because the function is slightly different and the preparation is slightly different. From a Rejuran perspective, PDRN comes in more of a topical form. Whereas Rejuran in this country, in most countries, when we refer to it, we are referring to an injectable that is made of this marine extract. And that extract happened to be the natural occurring basic block that form the DNA of the salmon. Right? So essentially, we are injecting segment of DNA from the Pacific salmon originated from the male reproductive organ. So I think that's the thing. A lot of the studies, I mean, if you look at the history in the literature, a lot of the studies has been talking about PDRN as a topical form, as a gel form in chronic wound. So if you look at, orthopedic surgeon, general surgeon, vascular, they've been using it for a long time because it is a very effective wound healer. So it wasn't until the last sort of 10 years or so, people think of it as application in the aesthetic world. Hence, the PN injectable form comes in. Now, it's worth mentioning because, everyone talk about the Kardashian having the salmon sperm. So that's a PDRN. I believe, correct me, Jake, if I'm wrong, the polynucleotide injectable Rejuran form is not approved in North America as yet. What they have is more of a topical form. So they tend to apply after some needling, after some lasering, those sort of things, just to apply topically. A lot of the studies have been going on for PDRN, not so much on PN. We're just slowly seeing some early studies, and we're extrapolating the result from PDRN. It's just a long window.
Yeah, that's a good summary, Stephen. I'm going to say it again. Salmon sperm, PDRN, PN or polynucleotide is the salmon gonad or testicle DNA, because this gets so confused. I want to be really specific because it's so confused. And also, when I was in America recently in February, what's really confusing is Rejuran is available as in the healer, the injectable form, but it's not FDA approved to inject it. So people are mixing these terms up because they can't use it the way that they want to. And it's just getting really confusing for people. So,
I mentioned Stephen was talking about the fact that this technology was used in wound healing. I remember you put something up in our Patreon WhatsApp group with this kid that had fallen over and grazed his face off, and apparently his face came back to life within a few days.
Yeah, well, maybe we'll come to that sort of later on. But yeah, it certainly is a healer as well as, what we're talking about, I guess, as an aesthetic product. Stephen, I want to touch on what you said sort of in your intro, the word or term regenerative aesthetics. I mean, what do you mean by that, or how would you describe it? Because I think every conference we go to now, it's the buzzword and everyone's getting excited, but I'm still not quite sure what we mean.
I think you're not the only one. I'm sort of also confused, but I think I'm just a simple plastic surgeon. I keep things very, very simple. For me, I think of stem cell as the ultimate regenerative medicine. Full stop. Right. So if you think of regenerative medicine, I think of something that supercharge the cellular environment. In this skin, we think about the extracellular matrix. Think of it modulating, supercharge, fertilize, whatever, so that it make that environment conducive for all the cell that swims in it to be activated. And then from there, the cells being activated is going to lay down more ground substance, going to lay down collagen, lay down elastin, which is the holy grail of any youthful skin, fat, bone, whatever. And the last part is also attract new blood vessels, so that the entire environment, it is more youthful, both in appearance as well as function. That's my definition of a regenerative, anything to do regeneration. And the major difference is it does not produce scarring. All right. So because we can get to the final outcome with laser, with needling, with other injectable so-called biostimulation, they all get to the final pathway. The end result is still scarring. Regenerative medicine, injectables such as Rejuran, do not produce scar. I think that's very, very important.
So it might be an obvious answer, but if you can still get to the final outcome with scarring, is there a downside to the scarring?
If you look at David, you're 21 years old, you're nice as skin, firm and robust. If we just, allow me to use a scalpel to cut through it, it's nice, firm and healthy. It is not full of scarring. So a lot of things that we do per patient nowadays, a lot of injectables, a lot of needling, those sort of things, we do produce collagen, but also part of it is scarring, because scar is also a form of some degree, some types of collagen. So if you use something that days in, day out produce a lot of collagen via scarring, eventually I would suggest that your skin and your fat will be quite sort of hard. And youthfulness is not hard. Youthfulness is pliable, is soft. So that is the problem. And then, of course, one day you may decide to have surgery. And a lot of scarring, not that we can't do it, a good surgeon will be able to go through it, but just make it just that much harder, particularly when we want to see where the facial nerve is. So that is what we're saying. I'm not saying it's bad. I'm just saying that with biostimulator, with regenerative, I think what we will see is we need to think of a more, I guess, clever and systematic way of how we rejuvenate the skin.
I think it's a good point, because our patients are understandably learning from what they see on Instagram and all this drama with the plastic surgeons in America about, the use of biostimulators. And we've spoken about that before. So when I'm talking about Rejuran or, other true regenerative products with my patients like the fact that it's literally their own cells sort of regrowing rather than, I guess, something artificial or not quite what they wanted being made.
Well, I guess it sounds like you're like crashing your car to fix it. That's basically.
No. I think it's not quite that bad. You have to. I think now is the time to think about how it works, right? So we think about as a healer, right. Aging process is a degenerative process. Some would call it as a disease state, right? Where there's sun damage, intrinsic, et cetera, because the skin becomes thinner, we get wrinkles, skin become more inflamed, you get redness, There's not much difference between that and healing a wound, because ultimately you need new cells to grow in, you need more collagen, you need ground substance, you need something to dampen down the inflammation, and that's so magical. So that's why if you look at all the studies from the wound healing, suddenly now is geared towards moving towards the aging process, because aging process, if you think about it, we want to regenerate newer, better, more useful, robust, useful tissue, and that's it. So I think Rejuran, if you think about it, there are a number of ways what we do. Polynucleotide, longer molecular chain, when you inject to it, it is believed to form more of a scaffolding effect. So the key cells in our dermis is this thing called fibroblasts. So what it does is provide a platform for it to hook onto it, to stretch it. And then in doing so, it activated through one way. When you inject Rejuran into your skin, Rejuran is quite viscous. So it's actually stretch your skin. That itself, there's a process someone smart 15 years ago called it a mechanical transduction to stretch the cell. In doing so, activate it. And the other cellular way is from the polynucleotide activating certain, I think it's A2 receptors. All these, once again, laying down to the final pathway, release of all the good growth factors, attracting new blood vessels and collagen and elastin. I think that's probably the best way to think about all this.
Yeah, that's a really interesting point you made, Stephen. I think a lot of injectors understand filariology and they understand things like G prime, and they use that in their head to decide, which tool to use. But when it comes to like Rejuran or a polynucleotide, it feels like a serum. It feels like nothing, but it has a structure when you look at it under electron microscope. And so the magic, like you said, it has a scaffold type structure, like a honeycomb. And when that stretches in a fibroblast, that's what's talking to them, as well as obviously it docking onto the A2 receptor. So it's not just like a serum, it's actually talking to the fibroblast, but also mechanically making them more efficient.
The other way to think about, 20 years ago, when we talk about traditional Chinese medicine, if you think about regenerative medicine, just like things like Rejuran or any other regenerative property, nanofat type of thing, it's a gradual process. It's not an instantaneous reaction, right? So it's more a repeat treatment. You get a gradual improvement and long-term. That's what you think about. You look at traditional Chinese medicine technique, it's completely in contrast to Western medicine. They think long-term. So when you take, some really yucky herbal medicine, you want to puke, but it's supposed to be good for you if you keep taking it. So it's a gradual, as opposed to taking a Panadol, right? Instantaneous, just like fillers. If you think about traditional fillers, it's a very instantaneous result. So Botox, okay? Everyone loves Botox because it just works. We know it works. Rejuran is a more gradual process. It needs repeated treatment, just like the traditional medicine. So it's not, patient, I just want to try one. Then I'll just say, well, maybe you shouldn't be doing it because you are not seeing the result. Even if you do, it's going to be so subtle. I think that's, if someone's going to sort of adopt using this, you got to think about the slight difference. I think the time has changed now. I think the whole world is changing from, we want something a little bit more natural. We don't mind to being a little bit gradual, but as long as we can see the improvement. And I think that's why I think it was Jake, you were telling me there's about a few thousand clinics in Australia has been adopting this technology.
I guess for the people who've never even seen Rejuran, maybe our American listeners or whoever, what's the core indication for using a polynucleotide? Like what sort of patient, should they be looking at, and what should the patient sort of be asking for from their practitioner?
Okay. So speaking from personal experience, in my office, we use it for variety of skin pathologies, from aging, thin, crepey skin, especially around the eyelids, patient with inflamed skin, redness, inflamed rosacea, patient with very, very sensitive skin, perimenopausal period where there is a disruption in the skin barrier. I think those are the key indicator. Now we use it, as we have mentioned, as a wound healing, to enhance healing. We use it following needling procedure. We use it following laser work just to promote healing. You get a synergistic improvement. I use it once again as an active wound healer in all my surgical facial aesthetic patients. After facelift, after eyelid surgery, we do it straight away on table. And someone who just want a much better skin. Those are the four main indications. The fifth one which I've started doing this year, is what we call priming of the skin before surgery. I think with any procedure, any surgical procedure, any aesthetic procedure, we want to do a great job, and hopefully we can't see any scar. So this stems from the fact that with Rejuran scar, we use it to treat established scar. We see that a lot. Incidentally, we learn a lot from our European counterpart, Ukraine, because I think there's an affiliation. I think the companies send a lot of their product to this war-torn country. And you see some horrific injury that has been treated in combination with Rejuran. And that's where I learned from, to start thinking, well, if we can use it for established scar, can we prime? Can we prime? Can we get the skin to be in such a great, useful, supercharged extracellular matrix before I create injury? So that's what I've been doing. Clearly, it's not an easy project to do unless you do a randomized study. You will not be able to get meaningful, but that's what I've been doing recently. So those are my indications, quite robust.
I have to say, I was a bit skeptical of polynucleotides, and I was taken to Korea by Rejuran when it first came out. So disclaimer, I'm a trainer for Rejuran, but at the time I didn't know much about it. And I met a Ukrainian doctor. In fact, there was about 20 Ukrainian doctors on our bus because we had to drive 4 hours across from Seoul to the factory where they made Rejuran. And in really broken English, I just sort of tried to introduce myself to this lady. And she told me exactly what you just said. She said that we're not using this stuff aesthetically. Obviously, we're in the middle of a war, but we've realized that we can use this on scars, on battle wounds, on burns, on all sorts of things. And the skin is just healing so much better. So why not? Why wouldn't you do that? So that really got my attention, because I was like, okay, wow, this is not just, superficial stuff. This is real medicine now.
The consultation process, as you said, Stephen, we have been living in a world where we all want and expect instantaneous results. And I think we created a bit of a problem for ourselves with, as you said, dermal fillers. They gave people the instant wow. They walk out being like a new person. I think part of the difficulty that injectors have today is, how do you consult for this product effectively? How do you start to educate your patient on the long game? It can be a difficult process for injectors.
I think this is I think we all, including myself, still learning about it, because there are, as an injectors in this country, we have choices. We have so much product we can use. At the end of the day, it really depends on the individual skin. So let's take one step back. We know this thing works. We know this thing works by getting you a more youthful skin in appearance and function in a slightly longer period of time than, let's say, your traditional skin booster with hyaluronic acid. So if patient just say, hey, listen, I've got a wedding next week, I want to do that, this is not for you. Okay. So if a patient come in, they say, you know what, I've had this done before. I just want to see, what are my options in the next 5 years. Now, then these are the ideal patients. Right? So if you have a patient that come in, the skins are quite reasonable, and all they have in the aging tissue, such as a crepey skin, then this could be the first option once you talk about how many sessions you need. Classically, we talk about 3, minimum 2 to 3 sessions, 3 to 4 weeks apart. And then we might thinking of, depends on how much improvement they want, to talk about a repeat treatment at about 6 to 12 months, more 6. So this is a long-term investment, not a one-night stand. Right? This is a long-term investment. If a patient come in and severe sun damage and dry, dehydrated, then it's a different matter. You may not necessarily use Rejuran as the first option. You may start some cosmeceutical together with some skin booster, where the main action is to hydrate the skin as a first option. Once you actually improve the quality, then you can talk about, hey, listen, this is much better now. We can think about long-term, how we're going to maintain this going forward. The advantage of this is, really, we know from our own experience and from overseas, from our Korean counterpart, Asian counterpart, is one of the most, what I'm attracted to as a unique selling properties of this product is, it has very minimal long-term problems, right? It has. I mean, I'm sure, Jake, you agree. I have not seen anyone come back with the nodules. I have not come up with an ongoing inflammatory reaction, which we were seeing with, all the other type of injectables. So this is a very safe product. We just have to educate the patient. Those are the reasons why a lot of us are attracted to it. And patient after the treatment, they will come back for it, right? And once again, the result is never a wow factor, right? Sometimes I take a photograph, I can say, yeah, I can see that improvement. But the reaction from the patient is disproportionate to what I have seen before and after photograph. So that's another interesting thing we are learning about Rejuran properties.
Yeah, I would agree with that. And I know, Stephen, you've got the clinical imaging system in your clinic. So photography is kind of vital with these sorts of patients. And it's part of the consult, because I don't know if you agree with this. I mean, my population of patients are basically white Caucasian, middle-aged women. I don't know what your demographic is, Stephen, but they've kind of got the worst skin versus, the Korean population where Rejuran is really popular. And they probably need it more than Asian patients because they haven't been looking after their skin. But it's a hard sell to sell a skin quality treatment in our clinics. So sometimes it is. They want, they want that instant impact like they've been used to in the past. So teaching people about skin with good photography is vital. Because they might not even appreciate the change. Sometimes you've got to show them. But like you said, I noticed this first with Profiler a few years ago. The patient feedback was far more than what I could see sometimes. They feel it rather than see it sometimes.
Right.
It's been the same experience with Rejuran. I can look at them and say, hey, you look pretty good. I hope you're happy. But they're like, I love it. And sometimes I can't perceive that because it's not my skin, but they feel it. That's interesting.
Absolutely. I think for those who have never used it, my recommendation is start with the eyes, the periorbital region, right? The skin there tend to be thinner. Even patient in their late 20s, early mid 30s, you can starting to see the dehydration, fine lines, and all this stuff. That's the one that will be consistently, right? You will see the patient come back and say, I love it. But once again, you take a photograph, just say, hey, some improvement. They love it. And after, spoken to so many patients, I think my conclusion is when you look at yourself, particularly when you look at your eyes first thing in the morning, remember, David, first thing in the morning, you look at yourself and you tend to look closely, and what they see firstly is the brightness, right? The skin is smoother, more supple, and you get that brightness and reflection, and that's what they see. Right? When you take a photograph, it's different. It's very hard to show the brightness. And all you see is improving texture, which you do see. And that's why the patient like it. And so the audience would never use it. The eye, periorbital region, especially lower eyelid, will be the first part that I would suggest you to do, because consistently, smaller area, you will get a much better sort of, how should I say, satisfaction from your patient. And they'll come back for more.
Yeah. I mean, would you agree that 95% of your patients are doing eye?
Yeah. The eye is number one. You make a very clear point. In Australia, particularly, we do know that our population age at least 10 years faster than our counterpart, whether it's Asia or North America. If you just match them based on ethnicity and race, it's full stop because of our harsh environment, right? So it is hard when someone come in with such a severe sun damage skin throughout the face and neck. You don't really know where to start, right? You don't know where to start. And even when they get a 20% improvement, it's like, okay, a needle in a haystack. So it's very, very different demographic to our Asian counterpart who prize that glowing skin. You have a 40-year-old come in, hardly any wrinkle, and yet they think that they're aging badly. So it's a very different way of consulting these patients.
Okay, so there's a few different versions of Rejuran available. So can you explain the differences and, when you might use one over another? I know that, there's some ways that the technology changes the density of the PNs as well. So can you just break that down a little bit for us?
Okay. So it's pretty simple, really. You talk about Rejuran I, you talk about Rejuran Healer, which we call it classic, and the Rejuran Scar. They all have the same concentration of PN, which is 20 milligram per mil. What is different is the viscosity. The I has the lowest viscosity because the eyelid skin tend to be thinner and more friable, and then move up to the scar because scar tend to be really dense and hard. So you need to be a lot more viscous to stretch that little structure within it. That's how you should think about it.
Do you do much scar work and use S a lot in your clinic?
So we don't do a lot. The little that we do, we tend to use Rejuran as a combination. Mm-hmm. So they tend to get some CO2 laser, as well as injecting the Rejuran directly into the scar. So I'm probably not an expert in talking about scar, but we have seen the effect from our Ukrainian counterpart. I'm sure you've seen that photo, will be like, wow, right? So clearly, once again, it's a repeated treatment. Scar is another complex thing. Normally, you need combination of modality, including Rejuran, to really supercharge the healing process.
Just one more question about the consult. How do you explain to your patient the difference between, crepiness and hydration? Because we've got different products on the market. So how do you steer them towards, no, you need Rejuran in this circumstance versus, something else in another?
Okay. So patient comes in, if you look at it, their skin's very, very dull and there's no elasticity and if you look at overall condition, they're scaly and all that stuff. For me, that's a very dehydrated skin. So I want to perhaps start off with something that I know is going to work very, very quickly so that they have the confidence that this is actually doing something, followed by, once I treat that area, I will use Rejuran in that region. As opposed to, let's say, lower eyelid. When you look at someone's lower eyelid, the rest of the skin looks fairly healthy, not dry, not peeling, then in those cases, I will Rejuran as a first go. Yeah. So hopefully it makes sense. Depends on dehydration versus crepiness.
And then you mentioned the protocol of, minimum 3. I know in Korea, they love it. They'll probably do 4 or 5, but minimum of 3. How far apart do you do them? Why do you do it that way?
Yeah. So firstly, I think people should know this is not the most comfortable treatment. Okay, I think we need to clarify that. This is not the most comfortable treatment because the product's quite viscous. You are injecting into the dermis. You are stretching the dermis. That itself causes quite a lot of discomfort. So I think there's no chance to get the patient coming back every week. All right. So you are injecting multiple dots. And that can take up to 2 to 3 days, depends on how thin your tissues is, to actually fully resolve. So there will be a period of adjustment and healing. I think the 4-week mark seems to be something that's tolerable for most patients. And I'm sure there will be some reason why the 4 months may be to do with the half-life. I'm not so sure. So that's what we've been taught, and that's what we've been doing. I think for me it's a minimum of 2. 3 will be better than 2, but it really boils down to acceptance and cost at the end of the day.
Okay. So obviously we talked about treating the eyes. Are you treating the whole face with it as well? What about the body, neck, décolletage?
Yeah. So in my office at the moment, we tend to deal a lot just with the face and the eye. The neck, not so much at the moment, because the neck in most Australian patients are difficult. Okay. It's a big area. It's really, really thin. And I think that compared to an Asian counterpart, you need a lot to actually see some improvement. I think it may just be cost prohibitively expensive to be able to do it. There will be some patient willing to pay for it, but I think, we will look for other combination that will maybe hydrate the skin a little bit more. So Rejuran, I tend not to use it at this stage, simply because costs come into the issue.
Yeah, I have to agree with that, Stephen. And, if you look at like a Caucasian neck that's sun damaged, it needs a lot more than just some poly.
Correct. The neck is the hardest, not necessarily just for Rejuran, for every single injectable product in there. It's thin skin, it's crepey skin, and then combination of underlying muscle, right? So it's not just like a face is thicker. So neck is a completely different category.
I do find it hard to explain to injectors when I'm training why that's the case. They just see skin and say, I'll just use some Rejuran. And they don't seem to be able to tease out laxity, elasticity, thickness, dryness, redness. They just see skin and think, I'll give it a go. And obviously some patients aren't going to respond to that. And then they blame the product. But actually it's just bad patient selection.
Correct. Yeah, absolutely. Beware of the neck skin, all right? You get a lot of good results from the face. The neck, you need a very different look at it. And you need to have, as you say, think about the diagnosis. What is it you're treating? Just because there's wrinkles in there, it could be just laxity, the skin just falling anteriorly, and you stretch it, the skin looks better. So no amount of injection will do it. The patient needs a surgery in those situations.
Yeah. Okay. Let's talk about your injection technique. You mentioned a few moments ago, lots of little dots. I'm hearing a lot of debate around cannula use. Can you just explain, how you go about administering the product?
Yeah. I think if we are looking at the facial skin, not the eyelid, I think it's thicker. So if we're really, really tightening the dermis, I would prefer to use needle. Eyelid skin is very different. Eyelid skin is a lot thinner. The older you are, the more sun damage. We're talking about 1 millimeter max, or 1.3 millimeter max in the lower eyelid, as opposed to 2.5 millimeters in the cheek. So in those situations, I think the Korean as well as some of our Thai doctors have done some studies comparing needle on one side versus cannula. And I think the consensus is there's no difference. Now, last year, I presented something in Korea where I talk about a combination technique for the lower eyelid. So I've been using cannula, not just as an injectable, as in using cannula to basically undermine the entire lower eyelid skin, as though I'm doing surgery, lift up the entire skin off the muscle. Then I will put the Rejuran underneath it. Then I will supercharge it by doing a sandwich. I'm still using needle on the surface to try to maximize my injury to the skin and get a maximal result from the healing property of Rejuran. And I think, hopefully in a few months, I should be able to announce the results. It should, as a healer, accelerate the healing, right? But in the same time, regenerate the, almost like a wound repair, tissue repair, also improve that quality of the skin. Just like when we talk about combination therapy, when you do a radiofrequency needling, we use Rejuran at the same time. So we know the injury from radiofrequency is going to improve the quality of skin. Together with the Rejuran, we're looking at the synergistic effect.
You're utilizing two of the properties of Rejuran, so healer and collagen stimulator.
Yeah.
You're maximizing the efficiency of two mechanisms.
Yeah, the downside is there's going to be a longer recovery time, right? Because I'm causing more swelling.
Yeah. Going back to the injection technique, the sort of the microboluses, do you have any top tips for injectors? I've learned that even though I thought I was doing it correct right at the start, I was probably going too deep. So top tips for people?
Yeah, I think I'll go as superficial as possible, obliquely at an angle. Depends on where you are. If you think you're superficial, go even more superficial. And sometimes you actually see a little bit of the product, leaking out. That's what you want. You really want to stretch that dermis. If you see, I've learned this from our Korean counterpart, and they do go very, very superficial. Yeah. And sometimes they put so many dots. It's almost like 50 dots become almost one big dot.
Yeah, I think that what I've learned is try to make the most tight wheel as possible. If you're not seeing that, you're probably too deep.
Correct. Correct. I'll tell you a joke. We talk about dot technology. When they first showed it to me, I thought that's what it meant, doing multiple dots, not knowing that what is it about? DNA optimizing technology. Just a simple plastic surgeon thought we'll just use dots.
Yeah, well, we didn't actually cover that term. It's probably important because it's proprietary to Rejuran. Or what is it in a nutshell?
I don't think neither of them. I think it's very proprietary. They talk about using their DNA, how they purify, how they handle it. That's why they call it optimize the technology. There are other products out there. So I don't think we will ever know what it means. Hopefully, we will hear more when some of the expert and some of the company people or the scientists come to Australia in very soon now, in a few weeks' time, isn't it, Jake?
Yes, we'll talk about that at the end. I mean, my understanding, like you said, there are other brands in Europe. There's, Italian makers and so on. And when my peers talk about European polynucleotides, they're assuming that they're all the same, but they can't be. It's like comparing one filler to another. They're slightly different, even though they're similar. So dot technology, it's a purification process. But it's also, like we said at the start, it's about creating that structure, that honeycomb. And in the 3 Rejuran subclasses, that they're different. One is more watery, one's more solid. So I'm assuming that the dot technology somehow creates that structure. But don't quote me on that. But that's where I think it comes into its own. And I don't think we can talk about all brands as being the same.
Correct. I fully agree. I mean, the Italian brand, I think, first of all, the source is from trout. Rather than from salmon, right? So, and then we can go through the argument about the DNA similarity between trout and salmon versus human. And I think there'll be another podcast, really.
Island, it's wild salmon that are utilized in Korea, whereas in Europe they tend to be farmed trout. Now, of course, do you want farmed chicken to eat, or do you want organic sort of, there's that sort of purity and quality that I think I would buy into if I had a choice of a product, but also just seeing the process, going to the factory and seeing these like really, really strong. I mean, you've done the whole thing where you catch them.
It was amazing, wasn't it? It was amazing how they go through the cycle of the salmon sort of migrating, throughout the Pacific from one to the other, how they tag them, the age of the salmon. It truly, I mean, from there, I have to say, for me, it seems to be a very ethical process. Nothing is being wasted. That's the second thing. So that to me was very, very impressive.
Yeah. And actually the Korean fisheries department manage the whole process, and they're counting the number of salmon every year. And if it gets too low or too high, they're overseeing it. So I kind of felt like, it's pretty cool. Pretty
awesome. Sustainable. It's very sustainable.
It's great.
Yeah. So we spoke about technique, but you also touched on pain. Have you had Rejuran?
Yeah, I have.
Did you find it a bit spicy?
It was pretty hot. Yeah.
Okay. I mean, I can see some of my patients not happy. It brings a tear to an eye. It's not uncommon to see
when they get the bill as well.
Yeah, exactly. But we want to obviously do everything in our power to keep our patients comfortable, especially when they're so used to most of the techniques that we do being, quite easy. So any top tips, Stephen, about how you might manage pain?
The usual thing we do, we numb them a lot. That's number one. We also use cold air to blow onto it as we inject, just like when we do a laser or any painful laser work. That seems to help a lot. But you got to warn the patient. It is uncomfortable. It's one of those things. We have not tried mixing lidocaine. I'm not sure whether that will help that much, because a lot of it, as we're saying, is a stretching of the dermis, right? So not like putting HA fillers in a deep space. This is a stretching of the dermis. So that's why I'm not adding that thing in it. Having said that, Rejuran at some stage, I hope will bring their next hero product in. This is the one that mixed with the HA and lidocaine. So I've not heard or discussed with my colleague to see whether that was more comfortable.
Yeah, I have to say I'm a bit of a purist. I haven't mixed it with lidocaine either because I'm relying on the property of the stuff to
and
do
the viscosity, the viscosity, right? Because you're going to change the viscosity of the product.
But there are colleagues doing it, saying it apparently works fine. Yeah.
Cool. Yeah. Dosage. How much do you need to treat a face? And like, what does it come in? Is it a 2 ml preparation?
I think the more the better. as a thing. And then once again, if costs become prohibitive. I think for full face, we tend to use 2 ml. For eye, I like to use 1 ml on each eye if the patient can afford it. And I think I truly believe that in this particular case, Rejuran eye comes in 1 ml. 0.5, I just think does not give the same result as 1 ml. So that's for someone who never used it. That's something important to know.
Yeah, I actually use the healer for the eye for 2 reasons. 1, gives me more product. 2, it's a little bit, it's a more punchier sort of potent product, if you like. So instead of doing, half a ml of eye 3 times, I'll do 1 ml of healer 3 times, which is effectively double the dose of the eye. I just think it gives you quicker results, better results.
And more pain.
Maybe more pain, but no pain, no gain, Stephen.
No pain, no gain. Yes, I agree.
Well, speaking of pain, we'd be remiss if we didn't talk about things like complications or things that can go wrong. Stephen, you alluded to the fact it's a very safe treatment, but anything that we should be aware of?
Well, yeah, I think we all have seen some patient with that swelling that lasts a little bit longer, slightly more than a week. We did have one patient in the clinic. This is a patient who had a lot of fillers, HA fillers around the periorbital region. I think that's something you need to be aware of. Patient who had a lot of fillers in the periorbital, in the cheek region, because this also, hydrate the skin in that region. So clearly it's going to attract more fluid. So those are the patients that are warned a little bit. But apart from that, it will subside on its own accord. So I have certainly not seen it. While we're on that topic, I think we need to also be aware that this is an injectable. You still need to try to do it in a very aseptic technique, remove all the makeup, because, contaminant can cause infection. If you have nearby fillers, it can also trigger some sort of, chronic inflammatory or delayed inflammatory reaction to the HA fillers in the surrounding area. So be mindful. That's a basic common sense that we should all apply as an injectors anyway. But overall, I think it's very, very safe. I've not seen any long-term chronic infection, inflammation, those sort of things. We're talking about this before, allergy. Okay, it's one patient with a salmon allergy. You can absolutely, bless your soul if you're allergic to salmon, because, we all love sushi in this country, in a lot of countries. When you're allergic to something, you're allergic to the protein, right, of the flesh. So in this case, this is a DNA, which is not a protein. So you absolutely can have this injected into you with no concerns whatsoever.
Yeah, that's a good point. I mean, the other obvious thing is bruising. I don't know if you're more meticulous than me, Stephen. But, I think bruising, especially around the eye, is almost impossible to avoid. Have you tried using the little nano needles or the multi needles?
Yeah.
Have improved your bruising rate?
Yeah, I use multi needles. I think, yeah, it really depends on the type of skin, really, right? In that region, there's so much blood vessels, so tiny little vessels. So it is one of those things you have to warn the patient. I guess you can use ice to vasoconstrict before inject. I've never used it. I just want to get it over and done with. I like the multi needles because I like to have multiple needle injuries for the reason that we talk about. Just create the injuries. Yeah, it's a lot faster too.
Are they the brand called Imatec? I've tried those ones.
Yeah. I like the Imatec, the 1 millimeter Imatec.
Yeah. I mean, they definitely work, and they definitely cause less bruising. I just found that, to get it flush on the skin, you sometimes have to use a bit of pressure, and sometimes your angle isn't, nice around the eye when it's contoured, but it's definitely worth trying.
See, in my case, I'm doing a sandwich technique. I've really put Rejuran rectangular underneath it. So it created a nice platform and slightly more rigidity for me to actually use the multi-needle onto it.
Yeah.
Interesting.
I'm assuming you agree that something like LED would help improve bruises if you do bruise them. Is that something you guys use in your clinic?
So yes, patient get LED immediately after as part of the patient experience. A lot of patients now they have LED. I certainly encourage them to use it. If they don't have it, I'll just use ice pack. No strenuous activities, no exercise, no Pilates, no downward dogs, type of thing for about 24 hours. And the rest, it will just take care of itself.
Do you believe in Arnica or not?
I do. I if they believe in it, I'll say go for it. Right? just like Hiradoid. If they use it, they have it. By all means, use it.
Combining or sort of these cocktails that people are putting together. Tell us some of your magic potions that you've come up with and what works well for you.
With Rejuran, I have not mixed any cocktail in there because it has regenerative property. It's not like HA, which is relying on a lot of the mechanical property. So Rejuran, I'm very, very pure. I just use pure Rejuran. I've not mixed lidocaine. I've not mixed anything else in there.
Yeah. I guess combining with other treatments, as you said, other modalities.
Yes, correct. So any form of devices, I'll go for it, including surgery, as I mentioned before.
Mm-hmm.
When would you do it, say after, I don't know, CO2? Do you do it immediately after?
Yes.
And do you inject it or you just drizzle it onto the wound?
Yeah. With CO2, you can drizzle it because the channel itself. With needling, I've not seen the science. I don't know how long the hole is going to be open for. So that's why with that, I'm still injecting to it.
Yeah, I've spoken to about 100 derms about this, and no one can seem to agree on what hole size it needs to be topically applied. So I agree. Unless you haven't, stripped off the skin like CO2, I think you should be injecting it.
Yeah,
correct.
Also, you're getting more collagen induction by actually needling it as well.
True.
Yeah.
You tell us about your Dubai story now.
Yeah. It's a good time to talk about it. Anyway, this is sort of completely anecdotal and very off-label. So, I'm not recommending that you guys do this, but a friend contacted me about, I don't know, 2 months ago, and his son's in my son's year at school, and he basically face planted at school and scratched along the concrete floor and had to go to hospital. He had a nasty bump on his forehead, which is sort of, rounded and bruised, but he'd lost, brazed his skin essentially. So road rash, we would call that in hospital. And anyway, so they cleaned him up and basically sent him home and said, oh, he'll be fine. And I said, this is a bit harebrained, but I want you to, if you're up for it, I want you to try and drizzle this stuff on. And it was Rejuran Healer. I use Healer. And so I showed his parents how to do it. And, just after he'd had his bath, etc., we just used a quarter of a 2 ml syringe. So 0.5 ml on all of the wounds, essentially 4 times. And he sent me a photo 6 days later. And, this is in our Patreon, so if you want to have a look at it, you can. But I was astonished. His parents sent me this photo 6 days later, and it looked like he'd basically, like nothing had happened. Apart from a little scar just under his eye where he'd really, sort of almost like a 3rd degree sort of laceration or lost all of the skin. I just couldn't believe it.
Yeah, I saw the photos come up. It was pretty impressive.
Yeah, and look, that's a case of one. So he may have healed on his own. That's true. Children heal very well. But I just thought it's something that, from my experience of speaking to the lady from Ukraine about wounds and scars, why not? You don't want him to scar. And it was completely easy to do, non-painful, no injections, just drizzle it on the wounds and hope for the best.
Yeah.
So that's my story. Any good stories of trauma that you've tried, Stephen?
No, I'm pretty boring that way.
Well, tell us about your experience with the surgical scars.
The priming thing is something that I have some profound interest, because as a plastic surgeon, we talk about making wound all the time. We talk about closing the wound with no tension. We talk about aseptic, but we have to talk about proactively minimizing wound even before we actually inflict that injury. So I think that's when I saw those photographs of my Ukrainian counterpart. That's when I thought, you know what, maybe there is something. So we should see. Hopefully, at some stage, someone would do a large randomized control trial, one side versus the other side with a facelift. Who knows?
Correct me if I'm wrong. I thought that previously on your inframammary scar for breast augmentation, you're using botulinum toxin there.
Yes, yeah.
So, but how and why?
That is not a control. I use that on patients that prone to have bad scars, specifically keloid scars. So basically, patient who's darker skin, Asian skin type of patient. So that, and then this is off the track of some studies of doing some injectable intradermal botulinum toxin. So that wasn't trialing. That was based on some papers. So that I'm still doing it, but this is a completely new thing. I'm talking about someone who is not, I'm talking about everyday patient that I'm doing a facelift, that we know that, with my deep plane facelift, I can almost say at 3 months, we probably can't see the scar. I want to see whether we can actually, accelerate that healing process. So hopefully by about less than 3 months, the scar will be much better. So that's probably harder to prove.
So when do you do your pre-operative Rejuran? And presumably you have to mark them up, in your clinic as if you were going to start.
Yeah. So at the moment, I inject them a few weeks beforehand. So I inject them where I know where I'm going to make that incision. Now, the other part is where I can't predict the other part of the wound where I'm going to. So that's when I'm also stem them in at the end of the procedure.
Okay. What was the learning curve like introducing it into your practice, I guess, getting your staff comfortable with it? How do you explain it to patients and so on?
Yeah, I think the learning curve is easy. All right. So it's an intradermal. The nuance is to be a lot more precise, as Jack mentioning it, to be as superficial as possible. We tend to think we're superficial, but we tend to go a little bit too deep. Right. So that's number one. That, from a technical perspective, from my staff who are all experienced injector, that is an easy thing. The harder thing is to patient selection. I mentioned all the different skin type we do. I think patient selection. I think the rosacea works well. Patient with red skin works well. Patient lower eyelid skin works well. And perimenopausal skin work very well. Those are the three consistent ones that you may want to start.
Okay.
Patient with a really, really bad skin, hard skin, who expect a lot, that's the one that you need to be a little bit concerned managing the expectation.
I don't know if you remember at the launch at the symposium at the W Hotel, you came straight on stage after my talk, and I had said, hey guys, this is quite exciting. This is one of the few products that you can talk about on your social media and website, etc. And you came on and you sort of reeled it back a bit and said, I don't know, guys, you might want to be careful. But what's your stance on advertising it in Australia? Because, rules are tight, but when we can talk about something, I think we should.
Yeah, so I have to apologize for that. Clearly, it's necessary. I think that was when we first have the TGA imposed on can't talk about. So I guess I would just be a little bit mindful. It seems to be the only thing that we can talk about. So I would encourage you to keep talking, using the brand as much as possible, because we're not breaking the rules and not breaking the law. So yes, we do have staff talk about it almost every week, because we can't talk about anything else, right? So yeah.
Where do you fit this into, I guess, the profitability perspective, and what treatments has this replaced, and in terms of how does it weigh up against the results and, I guess, the performance from a business perspective?
All right. I think it is two parts. My view is quite different. When it comes to things like Rejuran, where the skill is only about picking the patient, picking the right choice of patient. Once you've done it, it feels pretty easy. And the rest is just a technical exercise. Right? To be honest, this is not the most creative. This is not the most interesting way of doing it, because for me, it's a boring injection. So I don't see this. That is, we don't have a big margin for this. I just want my patient to have the best quality skin, knowing that this is part of the added service that I provide.
Right. Okay.
As opposed to something that require a specific skill set, such as, doing a beautiful lip injection, doing a beautiful cheek injection. For me, yes, there's a tool, but the rest also depends on the technical skill, but also how your assessment is, where you're going to put it. And I think that is the two differences.
Yeah.
If you understand what I mean.
Mm-hmm.
I think the beauty of a treatment like this is, at least in that initial phase, you've got 3 treatments, so 3 clinic visits. So it gets your books busy quite quickly if you've got a number of patients doing their initial sessions. And like you said, you don't have to charge top dollar per session, but you're seeing them for 3 sessions. So from a profitability perspective, that's good.
Yeah. And it's like an adjunct or a precursor to other things that you're going to do in your clinic. So,
if they're game for doing Rejuran, presumably they're game for doing toxins and other things that you offer as well.
Yeah.
So I think it's
not only that, they will come back. See, this is a long term. This is not just one of 3 sessions. That's it.
Yeah.
When they see the result, they will come back. So it will basically, as I said, per session, you're not going to charge a lot. You're not going to make a lot of money, but the long-term longevity of that patient in your clinic, and they get the result they want, they are happy, then there's this trust and rapport with your clinic. They'll come back.
Yeah.
For other things.
Yeah.
That's how I look at it.
Do you do it with toxins on the same day or fillers same day? What are you comfortable doing or not?
So no, we tend to do toxin, but not the fillers, because poor thing, it's they walk out, if you do the whole, just the eye, they walk out with 100 dots. 100 dots. So at some stage, I just think, and it's uncomfortable. We talk about it, so we don't want to traumatize them too much.
Yeah. I think it's worth hammering home what you said earlier, Stephen, about don't put Rejuran where you've done a cross-linked filler in the same plane. Stay away from it. There's just some rare cases of that sort of the histology looks like a lumpy appearance, and it's quite difficult to manage. So just stay away from those areas.
Yeah. Do you have any advice for injectors that would, I guess, have trouble deciding what product is going to be best for what patient? We've got so many treatment modalities now. And I think there's a lot of confusion about which product do they reach for under certain circumstances. I know we kind of alluded to it in some of the discussion, but if you could be maybe a little bit more direct about it, that would be great.
I think if you look at just a patient coming in, right, you need to look at the aging process. What will be your number one priority? If the patient is so severely volume depleted, or have such a severe dynamic wrinkle, Botox will always going to be your number one thing, because it works, it's efficient, people love it, people see it, they'll come back. You want to create that rapport for you. If the patient come in so volume depleted, and you just say go for Rejuran, who is a slow process, they're not going to come back. So that's number one thing. So for me, always go for the priority. If you're so depleted, put the volume in there, because you look at it, they get compliment from all their friends, right? No matter who they are, how old we are, male, female, we all love to get some compliment. Unsolicited compliment is your best friend. Then we'll come back, because it gives them validate that what they have paid for is worth the money.
Yeah.
Right. And then they'll come back. Then that's when you actually say, well, fine, it's your treatment plan. What is the next priority? It is the skin. Let's talk about your skin. That's the time they say, hey guys, I noticed that there's a crepiness around the eye. Let's talk about it. How do we manage this for you? So even within Rejuran, think about your eyes first, right? Don't go for the neck, because once again, You go for the neck, it's like bottomless pit. You're not going to see the result. So once again, it's about understanding, using your skill set in assessment to pick the right area, even using the same product.
Yeah, I couldn't agree more. And something that I do with my patients is, in the consult, we can talk to them about product and so on. I just tried to make it very tangible. So I'm reaching for this tool because it's a hydrator, but I'm reaching for this tool because it's a skin thickener, and particularly around your eyes. Or I'm going to use this one because it's a muscle relaxer. And just keep the terminology simple. But just tell them, why have I chosen that tool? And does that tool match the thing that you're looking at in the mirror saying I don't like? Yeah. If they don't match, then that's the wrong tool.
Yeah. So it sounds like this isn't a treatment for a new entrant into, I guess, the anti-aging world or the treatment world, because you're not going to get that wow. They're not going to be able to see that result. And I guess the new relationship's so important to build that trust, get them happy straight away. And this is more of a long-term sort of second and third stage introduction and then ongoing.
Well, unless the patient is so suitable, right? Yeah. So you have a patient in their early 30s, always a beautiful skin. There's nothing wrong with the volume, minimal dynamic wrinkles, who just want something that is, inverted comma, slower, more natural, long-term thing. They could be the right person, right? I mean, it's not common, but we do see them. Yeah. We do see them. So those are the ones that I say, okay, fine. There's a Rejuran here. Give it a try.
Yeah, I agree. I've had a handful of patients. They've done their research. They've been to Korea. They might have had one session already, and they're just there for more Rejuran. Yeah. And I think that's completely reasonable. Yeah. But if you've got a new patient who's never dipped their toe into aesthetics and they're coming to you with multiple concerns, it probably wouldn't be my number one, but it definitely would be on my list of stage 2, stage 3, or whatever. Yeah. We've just got a couple of listener questions. In fact, I think we've answered most of them, but a few people were asking, I'll just quote their name to shout them out. Maria Reed, Marie Tresna, and Dr. Victoria Scott Lang. They're all in our Patreon. They're all asking variants of the same question, this post-Rejuran eye swelling, or let's call it post-polynucleotide eye swelling. I personally haven't seen it. I don't know if I'm doing something different to other injectors, but what's your experience with the swelling, and how problematic can it be, Stephen?
Yeah, I don't think I have seen it. I expect the way that I've done the patient, they'll probably get swelling for about 4 or 5 days. Right? The way I've done it, we are really, really go for it. If you just use the needles with 50 dots on each side, then I'll still say about 3 to 4 days, but nothing longer than a week so far. And I say the one that we have seen referred to us is a lady who had a lot of fillers in the tear trough region. So those are the one that is going to perhaps have more swelling linger on. And you mentioned it too, is people who have a lot of fillers in that region. If your technique is not a aseptic, if you like it can trigger off some other problems that we have seen from contamination, such as inflammation in the HA region. So I'm not sure whether we can answer to your listeners is I have not seen it. When they say long, prolonged, do they mention how long the swellings? Few weeks, few months?
Yeah, I don't know. I have to admit, I've not seen it myself, and at least 2 of these people are not in Australia, so they won't be using Rejuran. One's in Ireland, one's actually in Dubai, so maybe using different brands. Yeah. I mean, look, I would probably look at, like you said, backing off if they've had any other fillers around the eye, making sure your depth is correct. And, if the skin is very lax to start with, maybe just reducing my dose just to see how they go. Those would be my top tips. Yeah. So any sort of summarizing comments, Stephen, parting comments of, someone new to this thinking, hey, that podcast sounded interesting. I want to get involved, but what are your top tips?
Top tips are, this works. This is a gradual process. Pick your patients. If you're going to try just pure aesthetic, your periorbital will be your best friend, best place to start. In the eyelid, to me, in Australia or in most countries, I'll still say this is the safest injectable in the eyelid skin with no or very minimal long-term problem that we are aware of to date. For us in this country, we've been using it for close to 2 years, and for colleagues overseas, this is truly what I call, the safest product to the lower eyelid to improve the skin quality.
Yeah,
Excellent.
Fantastic.
Thank you, Stephen.
We just got one, I guess, announcement or message. We alluded to it right at the start. There's a Rejuran Academy here in Sydney. It's actually tomorrow, by the time this podcast is out, June the 1st. That's at the W Hotel. The program's for all levels. So whether you're a beginner, never touched Rejuran, or you're an expert, there'll be something there for you. There'll be some local KOLs, international KOLs. I'm attending, but I'm just going to be enjoying. I don't know if you're going, Stephen. Will you be attending?
Yeah. So unfortunately, it's the day I fly out of this country. I think the company did it intentionally. But anyway, I think this is a good initiative. I think they're trying to get all the practitioners, workers who are interested, who's been involved with it, to create a network, a local network, to learn from each other, local as well as international experts, because there's so much things that is still used to be explored. Every one of us does it differently. And I think this is thing that, we can learn from each other, how to minimize pain, as you mentioned before. What are they doing it differently now? What are the things to come? I'm so sorry that I'm going to miss out, but I will, I'll be tasked to film the videos to give some of my inside things I've learned about Rejuran, particularly my new technique of doing it. So, I think everyone should go. If you're interested, you're remotely interested, or you're novice, or you are expert in Rejuran, I think you'll learn something.
It's going to be a big event as well. There's 400 people going or something.
Wow.
So, it'll be good.
Few people.
Yes.
Well, thank you very much for your time, Stephen. Always a pleasure to have you on and sharing your knowledge and experience. Thank you very much.
Yes, your 5th appearance now.
Yeah.
I hope you're not getting sick of us.
Well, I think the next one will be the best, that we're going to do even more.
Yeah, we're looking forward to it.
All right, thanks again. See you later. For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.